Welcome to another episode of Chill with Bill at San Antonio Zoo. And today, fortunate enough to have Dr. Elizabeth King, a gynecologist at North Central Baptist Hospital. Dr. King, did you know that they actually provide annual screenings for the female tigers here at San Antonio Zoo?
I did not know that.
But it's very important, right?
It is. It's an important way to detect common gynecologic problems a lot of women don't know that they're faced with until they come in for that checkup.
Now, you specialize in gynecology surgery. So can you tell me a little bit about that?
There are all kinds of conditions that women can face gynecologically that can be treated surgically. We offer robotic surgery, which is a minimally invasive way to treat some common gynecologic issues.
Can you tell me about some of the advantages of robotic surgery over traditional open surgery?
Robotic surgery, like I mentioned, is minimally invasive, which just means that it's not nearly as difficult to recover from as a traditional type of surgery. Minimally invasive surgeries are what you've heard of as hysterectomies, oophorectomies. That's removing female organs, but instead of doing that through large incisions, we're able to do that through just some very, very small incisions. Because it's done with a robot, that is actually gentler on your tissue than actual human hands could be. Everything's magnified in 10 times and it's viewed through an HD screen. So I can see better inside somebody's abdomen with a robotic camera than I can with my own eyes.
Is recovery shorter with robotic surgery versus an open type procedure?
It's not necessarily shorter, but it's a lot easier. So it typically takes a woman 6 weeks to recover from a procedure like a hysterectomy. But when it's done in a minimally invasive way, there's often a lower risk of infection. She's able to go home the same day, and she's able to get back to work quicker. Most of my patients don't even have to take narcotic pain medication, which is really important. A lot of them are moms and they're on the go. They need to do things like pick their kids up from school and get back to cooking and taking care of them. And they're able to do that when they have this type of surgery as opposed to an open procedure.
Dr. King, would you tell me a little bit about the new ORs in the Women's Center at North Central?
The North Central Baptist has long been a great place for women to go for their care. I had all 4 of my children there, and it's been well known for a place to go to have your babies in San Antonio. There are women who are undergoing hysterectomy. That's often their first time to undergo a surgery. It's hard as a woman to go from the side of bearing children to crossing over the road to where you're not able to do that anymore. And unfortunately, some conditions do make that the best option. I think that women who go to North Central Baptist are able to feel comfortable in an environment they may have been in before, and one that's been used to taking care of women from the time that they've entered going to the hospital for any type of procedure.
Dr. King, how would somebody know that they have a problem that needs to be addressed by a surgeon like you?
That's a great question, Bill, because often women don't know that they have any problems. They think that issues such as heavy menstrual bleeding or urinary incontinence are just normal occurrences for a woman. Oftentimes, they don't know what's normal and what's not. And when they come in for their annual checkups, a lot of times we're able to delve into that and discover some of the issues that they're having, and then we can treat them.
Dr. King, thank you for coming out and chilling with Bill here at San Antonio Zoo, right here in the tiger habitat.
You're welcome. Have a great day.